Good day, panelists. We are the Group D, and we will be tackling about the acceptance rate on the COVID-19 vaccines available in the Philippines.
To start our presentation, let's start with the introduction. The World Health Organization declared coronavirus to be a global pandemic in March 2020, indicating a new global spread of infectious disease. Over 109 million cases of COVID-19 worldwide have been reported recently. COVID-19 has spread to every country in the world, ensuing a number of more than 2 million casualties. According to the Center for Strategic and International Studies, analysis on the COVID-19 mortality rate in Southeast Asia, the Philippines ranked second with the most number of casualties as of January 2021. To counter this, the development of vaccine began in several research centers and pharmaceutical companies immediately after scientists found out the causative agent and the first genome sequence was published. The successful rapid development and widespread acceptance of COVID-19 vaccine will be a great step in countering the global health crisis, yet gaining high uptake from the public will be a challenging task, becoming even more difficult with online misinformation. According to A. Malik in 2020, immunization programs are only deemed successful when there are high rates of acceptance and coverage by the public. The objective of this study is to describe and to be able to quantify the current acceptance rate of the students on the COVID-19 vaccines available in the Philippines, with aims to, number one, identify underlying factors under possible reluctance in being vaccinated. Number two, identify which specific vaccine the majority are willing to be inoculated. And three, provide verified information and statistics for public health officials and professionals to begin an effective messaging campaign to enhance the general public's trust on the vaccination.
For our conceptual framework, we devised a diagram which will help in explaining the relationship between variables in accordance with the COVID-19 vaccine acceptance. As shown in the diagram, there are three main factors that are observed determinants based on the World Health Organization's SAGE group in vaccine acceptance that can be connected to the subjectively perceived COVID-19 vaccine acceptance. It is also shown in the diagram that money may influence the vaccine acceptance in spending it to procure vaccination. All of these factors will lead to the outcome of acceptance rate of COVID-19 vaccine in the Philippines. And for our definition of terms, we will now explain the terms used in our study for the better understanding of the readers. Acceptance rate, the percentage of the population that agrees to participate in procuring the vaccine. COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, VI to virus, and D to disease. Coronavirus, any of a group of RNA viruses that cause a variety of respiratory, gastrointestinal, and neurological diseases in humans and other animals. SARS-CoV-2, severe acute respiratory syndrome coronavirus 2, is the strain of coronavirus that causes coronavirus disease 2019. The respiratory illness responsible for the COVID-19 pandemic. Vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. Threatens to reverse progress made is tackling vaccine-preventable diseases. Vaccinated, treat with a vaccine to produce immunity against a disease. Vaccination, treatment with a vaccine to produce immunity against a diseases. Vaccine hesitancy is the delay in acceptance or refusal of vaccine despite availability of vaccine services.
The coronavirus pandemic has caused a major disruption all over the globe, halting economies and daily activities and bringing about millions of casualties worldwide. Many countries are racing to develop a safe and effective COVID-19 vaccine, which will expectantly end the COVID-19 pandemic. As of February 2021, the current vaccine portfolio from the Philippines, according to the Department of Health, consists of 7 vaccines: the AstraZeneca-Oxford vaccine, the Gamaleya Sputnik V, the Johnson & Johnson's Janssen, the Moderna, Pfizer-BioNTech, and the Sinovac Coronavac. As of March 5, 2021, only Pfizer, AstraZeneca, and Sinovac have been issued an emergency use authorization or an EUA by the Philippine Food and Drugs Administration. The efficacy data obtained by the DOH after Phase 3 trials have shown that the AstraZeneca COVID-19 vaccine confers a 90% efficacy rate when a person is initially given a half dose followed by a full dose. The Pfizer-BioNTech vaccine against symptomatic COVID-19 after the second dose confers a 94.7% efficacy rate. On the other hand, the Sinovac COVID-19 vaccine's efficacy rates reached up to 50% at preventing mild and severe COVID-19 cases. However, a recent study in Brazil has proven that the Sinovac COVID-19 vaccine can rise up to 80 to 90% according to a study in Brazil. A study conducted by Bhopal and Nielsen in 2021 gathered a total of 140,000 individuals from 140 different countries to answer a survey regarding the public's attitudes towards COVID-19 vaccine, health, and science. The survey produced results of 94% and 90% of both South Asia and East Africa that described vaccination as effective. Similarly, 95% and 92% from both East Africa and South Asia perceived vaccines as safe. In comparison with Western Europe, only 59% of the respondents believed that vaccines are safe. This perceived trust and safety is shown to be highest in low-middle income countries and is shown opposite to first world countries. This just shows that even if presented with facts and information relating to the safety and efficacy of a vaccine, the one that's going to be the most prominent deciding factor whether they take up the vaccine or not are their attitudes towards vaccination. An online survey conducted by Registry between October 28 and November 18 assessed the acceptance of COVID-19 vaccination among pregnant women and mothers of children younger than 18 years old, as well as possible predictors of their vaccine acceptance. A total of 17,871 survey responses were collected from 16 different countries. With a COVID-19 vaccine efficacy rate of 90%, 52% of pregnant women and 73.4% of non-pregnant women expressed a willingness to receive the vaccine. 69.2% of pregnant and non-pregnant women said they planned to vaccinate their children. Vaccine acceptance was highest in India, the Philippines, and all Latin American countries sampled. It was lowest in Russia, the US, and Australia. Confidence in vaccine safety and efficacy, concern about COVID-19, belief in the value of vaccines to their own country, compliance with mask recommendations, trust in public health agencies or health signs, and attitudes towards routine vaccines were the strongest predictors of vaccine acceptance. Women's acceptance of the COVID-19 vaccine and its predictors differ around the world. To have the greatest effect, vaccination programs for women and children should be customized to each region.
In order to obtain the data of our research, an online survey will be used. We will be collecting detailed, precise, and factual data to inspect the existing phenomena. This study is quantitative since its aim is to measure the number of students who are willing to get vaccinated using various statistical instruments. During the whole course of this study, an online platform will be used. The research locale will be at the Cebu Institute of Technology University. Our reason for choosing the research locale is primarily for our convenience in communicating with the chosen respondents. We will be getting responses from 200 senior high school students at Cebu Institute of Technology University. We will select random students among the 53 sections in the senior high school department. We chose the senior high school students for these following reasons. 1. Majority of the school's population consists of senior high school students. 2. They fit in the age group that mostly dominate social media, which is the primary source of COVID-19 information. 3rd, they are a discerning population that is well aware of the current health crisis, thus making them capable of giving out their opinions regarding their acceptance on being vaccinated. We will be utilizing a simple random sampling technique and
Greetings! Another part of the research methodology is a data gathering procedure, and I will be tackling of how we are conducting our procedure in 4 stages. First stage would deal with the creation of online surveys that will be handed out to the senior high school students from the CITU in an online survey with the use of Google Forms. The second stage deals with the selection of students who would volunteer in answering the research questionnaires provided by us, the researchers, with the use of Facebook as a social media platform for contact. The third stage will be the answering of the survey through Google Form, where the respondents will be given an ample amount of time to prevent answering the questions hastily. Fourth, and also the last stage, the fourth stage will consist of the gathering of data from the survey responses, which then will be tabulated by the assigned researcher and to be interpreted to the basis of analysis.
For our research instrument, we will make use of a survey designed by Mokatash and others in their survey questionnaire for COVID-19 vaccine preference analysis in the United Arab Emirates. Since it is not possible to hand out hard copy questionnaires to the public, we will make use of online platforms in gathering the data, which will contain mostly of closed-ended questions. The survey questionnaires will have 3 parts. The first part will be questions about the socioeconomic and demographic background of the respondents. The second part will be about the respondents' overall knowledge and experiences with vaccines, as well as their knowledge towards COVID-19 vaccines. The contextual influences such as the influence of historic, sociocultural, environmental, health system, institutional, economic, or political factors that influence the decision with being vaccinated with the COVID-19 vaccine. Finally, the third part will be questions asking about the peer influences that affect their perception on COVID-19 vaccines, as well as their acceptance of it.